Thank you, Ambassador Squeff. I also want to begin by thanking all of you for joining us today on this important discussion. We would not be here today without the support of a number of groups and individuals. So let me begin by acknowledging the Canadian Medical Association, who have supported our work to achieve full human rights for older persons since we began 6 years ago. We appreciate their generosity and social commitment to health in all its full sense. You will hear shortly from the Canadian Medical Association President, Dr. Ann Collins. Likewise, Home Instead has been a strong supporter from the beginning, with leadership from the top, Paul Hogan, Phyllis Hegstrom, and in Canada, Marg McAllister. And a very special thanks to the International Federation of Aging, who have been superlative partners. I want to particularly acknowledge Jane Barat, Andra Stenko, and Ashley Patrick for their dedicated support. Thanks also to all the partners whose logos you have seen on all the material for this special event, and a special thank you to Amal Abu Rafe from UNDESA. Now, we are here today to discuss how COVID-19 has impacted the human rights of older persons internationally, because we know the pandemic has shone a light on the most flagrant violations of human rights of older persons and the international prevalence of ageism in its most vicious form. Now, whether it has been the loss of the right of freedom from violence, as we have seen in skyrocketing cases of elder abuse, the loss of the right to health, where older people were barred from hospitals, the loss of the right to social protections, leaving people without income or food, or the loss of the right to autonomy, where random age restrictions were put on older persons' liberties and freedoms. The global evidence of discrimination is quite frankly overwhelming. Indeed, the wholesale impact of ageism and age discrimination has been devastating, compounding the impact of the pandemic on the old through unnecessary deaths, suffering, mental anguish, isolation, and stigmatization. In my own country, Canada, a country regularly listed as one of the best places in the world to live, a country with a rich human rights history, both domestically and internationally, a country with a publicly funded healthcare system and social safety net, we saw older people die of malnutrition, dehydration, and neglect in long-term care homes in some of the richest cities in one of the richest countries in the world. Indeed, today the Canadian Institute of Health Information released data showing Canada had the worst record for COVID-19 deaths in long-term care homes among all wealthy nations. The study found that deaths in long-term care in Canada were 69% of overall COVID-19 deaths, significantly higher than the international average of 41%, a shameful statistic in its own right. Now, we, a G8 country, have a long-term care system so incapable of handling a crisis that the Canadian military had to be called in to save frail and sick Canadians, resulting in the most damning and heartbreaking military report. The treatment of older people during the pandemic across the globe, quite frankly, defies logic, never mind compassion and justice and human rights. We need to ask ourselves why age discrimination is not being treated with the same gravity as other forms of discrimination, and how do we address this injustice? Well, there is a remedy which could help us to confront and defeat ageism and age discrimination, and that is the Convention on the Rights of Older Persons at the United Nations. International Longevity Centre Canada has been arguing for a convention on the rights of older persons since our inception in 2014. But as many in this meeting know, the call and work started long before that. Many of you did it. And yet here we are today in a United Nations session, armed as we have been from the beginning with data and evidence, asking again that this huge gap in universal human rights be addressed. So I ask you, why hasn't action on a United Nations Convention on the Rights of Older Persons begun? We know that age was left out of the original legal human rights document, the Universal Declaration of Human Rights, but it was written so that groups who have had neglected rights can have those rights enhanced by supplementary conventions. We have seen successive treaties, such as the Convention on the Elimination of Discrimination Against Women, the Convention on the Rights of Persons with Disability, and the Convention on the Rights of the Child, come into effect and have clear and positive impacts on the lives of rights holders. We know conventions work. We heard yesterday, speaker after speaker describe unbelievable human rights violations experienced by older people everywhere around the globe. And here we are at the world's largest human rights organization, the United Nations, and still not taking the obvious critical step for real change. We are calling again for member states to take the initiative and begin the process of drafting the Convention on the Rights of Older Persons. My own country, Canada, stated at the open-ended working group in 2018 that the door was open for Canada to support a convention. We urge you, Canada, to step through that door and take the incredible initiative you did earlier this spring when you supported the United Nations General's policy report and brought other members on board. Sitting on my desk is a plaque with the brilliant and inspiring words of the Universal Declaration of Human Rights. All human beings are born free and equal in dignity and rights. Let's make that truly all, including people of all ages. Let's have a convention on the rights of older persons. Now, let me introduce our next speaker. We have an absolutely fabulous lineup of speakers. His Excellency Ambassador Omar Halil is the permanent representative of the Kingdom of Morocco to the United Nations. He's also chair of the Third Committee of the General Assembly in charge of social, humanitarian affairs, and human rights issues. Morocco, along with Canada, were 2 of 5 countries that supported the UN Secretary General's May 1st policy paper, which I just mentioned, on the impact of pandemic on older persons. And these countries were successful in getting 146 countries to support the Secretary General's important report. Ambassador Halil, you have the floor.
Thank you very much, dear Margaret. I would like at the outset to express my deepest sympathy following the loss of lives due to the coronavirus, and the majority of whom are older people. I would like to thank you for organizing this timely event as the world is going through an unprecedented pandemic that is having devastating and multi-phased impacts on the lives, well-being, and rights of older persons. The impact adds to the already existing multiple and intersecting forms of discrimination and violence experienced by older persons, which aggravates their vulnerabilities. The Kingdom of Morocco, together with Argentina, Austria, Canada, Chile, El Salvador, and Slovenia, took the initiative to issue a joint statement to strongly support the appeal by the Secretary General to promote responses to the pandemic based on the respect of human rights, dignity of older people, as well as global solidarity. This joint statement, supported by at least 146 member states, expressed namely our deep concern regarding the devastating impacts of COVID-19 pandemic is having on the lives of older persons. It also underlined our full commitment to promoting and respecting the dignity and rights of people, older people, and mitigating the negative impacts on their health, lives, health, and well-being during and after the COVID-19 pandemic. The Secretary General's policy brief underlines while the pandemic spreads among persons of all ages and various conditions, older persons are at significantly higher risk of mortality and severe disease following infection, with those over 80 years, all dying at 5 times the average rate. This number by itself is unacceptable, alarming, and calls for an urgent, concrete, and durable action. Furthermore, older persons' rights are not fully respected in many countries around the world. Many older persons are subjected to discrimination, violence, and abuses without any international legal specific instrument protecting mechanism or their human rights. This is why there is an urgent need to decide on an international legal framework that guarantees the exercise by older persons of all human rights and fundamental freedoms on an equal basis with other segments of society. In this regard, the idea of convention would be the most concrete and useful international framework that would respond to this purpose. Meanwhile, older persons cannot wait, and their requests are valid if we take into consideration the following points. Article 1 of the Universal Declaration of Human Rights underlines that, and I quote, all human beings are born free and equal in dignity and rights, and of course. Article 22 of Universal Declaration of Human Rights states also, everyone is a member of society, has the right to social security and entitled to realization through national effort and international cooperation, and in accordance with the organization and resources of each state of the economic, social, and cultural rights, and responsible for his dignity and the free development of his personality. And of course, Article 25 stipulates everyone has the right to a standard of living adequate for the health and well-being of himself and of his family, including food, clothing, housing, and medical care, and necessary social services, and the right to security in the event of employment, sickness, disability, widowhood, old age, or other lack of livelihood in circumstances beyond his control. A central theme of the Madrid International Plan of Action on Aging of 2002 was the full realization of all human rights and fundamental freedom of all older persons. The 2030 Agenda also emphasized the responsibility of all member states to respect, protect, and promote human rights and fundamental freedoms for all, without distinction of any kind as to race, color, sex, language, religion, political, or other opinion, national or social origin, property, birth, disability, or other status. It calls for leaving no one behind and for ensuring that the sustainable development goals are met for all segments of society at all ages, with particular focus on the most vulnerable, including older persons. Despite the global overall international framework, it is not sufficient to promote opportunities for older persons. Effective participation in economic, social, cultural, and political and civil life and existing international human rights mechanisms have not adequately protected their human rights. Concrete efforts are urgently needed to address the challenges faced by older persons, and especially older women who face intersectional discrimination based on older age and gender. I would like to also underline that while it is essential to address the exclusion and vulnerability of an intersectional discrimination against many older persons in the implementation of the new agenda, it is even more important to go beyond treating older persons as a vulnerable group. Older persons must be recognized as the active agents of societal development in order to achieve truly transformative, inclusive, and sustainable development outcomes. While we build to recover from COVID-19, it is fundamental that we put the full protection and enjoyment of all human rights by older persons front and center, and that at the heart of international community's effort to recover from this pandemic, both at the national and international levels. Even more, since older persons are the part of the society which was the hardest hit by this pandemic, it is fundamental to make sure that we take fully into consideration the health, socioeconomic vulnerabilities of older persons and put them at the center of our global response, and they should fully participate in its inception and implementation. In addition, and in conclusion, it is extremely important that we all endeavor for fair and equal access by older persons to vaccine all around the world. And they would like to stress here how important that developing countries, especially in Africa, have equitable and fairly access to the vaccine. We all know that for this pandemic, no one is safe until everyone is safe. I thank you very much for your attention.
Thank you very much, Ambassador Halil. We absolutely agree that one of the best way forward is with a convention on the rights of older persons. And we absolutely agree that civil society needs to be involved, and also agree that vaccines need to be universal for all of us to be safe. So thank you for those messages. They're very well received. I'd now like to introduce Dr. Alice Kalash, President of the International Longevity Center of Brazil and former director of the World Health Organization's Global Program on Aging. Dr. Kalash has been a leading specialist in aging issues for over 45 years, known for groundbreaking programs such as the World Health Organization's Age-Friendly City Program and the World Health Organization's Active Aging Policy Framework. He's an inspiration and a friend to so many of us in the aging field. Dr. Kalash, you have the floor. Oh, you're up. We need to take you off mute. We don't want to miss a word.
Thank you very much, Margaret, and dear friends, dear panelists. I'm sad, I'm angry, and I am frustrated. I'm sad because we have counted to 320,000 deaths by COVID in Brazil so far, and the number hides a huge underestimation. Over the last few weeks, an average of 3,000 deaths daily, more than the lives lost at the Twin Towers terrorist attack every single day. Sad because the rituals that can heal and support relatives in their grief are suppressed. Solitary bereavement, silent mourning. Sad because 80% of COVID patients who have been intubated in Brazil died, when in the developed world the figure is less than 40%, like in our best private hospitals. Sad because deaths by unrelated causes have increased by 1/3, as patients do not find a hospital bed or delay treatment because they are scared. But I'm also angry when I see that last week Brazil had more deaths than any other country, more deaths than the other 4 countries that in the top ranking, USA, Mexico, Italy, and Russia added up. That makes me sad. Angry because although the Brazilian population represents less than 3% of the total world population, the number of deaths is close to 30% of the total. Angry as I see the health system collapsing. Even the funerary system is under such a stress that families have to dig the graves to bury their own loved ones. Angry because it did not have to be like this. It was the distrust of science, the lack of compassion and solidarity, empathy, the disregard for the lives of all the people that led to this disaster. And our so-called leaders are still advocating the use of chloroquine as early treatment, as they have until recently refused to wear masks and encourage agglomeration even in the presidential palace. Angry because oblivious to his own age, the president turned 66 this month, he made statements in relation to COVID like, oh, the people should be prepared to sacrifice themselves so that the younger generation can carry on with their lives. They have already lived their lives. Let them go. Angry because the statement read here by the official Brazilian representative disregarded all the brutal reality of what is happening in my country. And I am frustrated. When I see no progress over the discussions here at the open-ended working group, also little progress. I have attended every single of them, and by and large, I hear the same arguments, the same disregard for what had happened the year before, the same deaf ears from governments with their own agendas prevailing over the real interest of rights of other people. They needed to be protected throughout the world. Just think of what you have just told us, what has happened in long-term institutions in Spain, in Italy, in France, in the UK, here in North America. Tragedies have occurred not only in the global south. There is no need for consensus. All that is required at this stage is to appoint a committee. Let us be pragmatic. A small committee, well chaired, to start drafting what is necessary to make progress. How long more are we going to wait? Last week, the Brazilian Congresswoman, Janaína Pascoal, issued the following public statement. I'm concerned about all lives, but the lives that have lived less concern me more. Moreover, I think that it is now time to establish clear ground rules to prioritize the use of our available resources, beds, respirators. It is tough, but necessary. This thinking in relation to the pandemic can be found being applied all over the world, either as an action of policy or default. Triage based on the likelihood of survival or simply the number of years lived is but one of the main examples where older lives are given less value. We have seen a failure to fully incorporate older people into clinical trials for the development of treatments and vaccines, ageism. We have seen an exclusion of older adults in most of the necessary conversations. They're excluded. We have done little to support caregivers, especially older caregivers, or to address older age poverty and mental distress within the context of even greater social isolation. It is callous. Brazil is one of the world leaders in food production, yet food insecurity and actual hunger is on the increase across all age groups in Brazil. Over 40 million Brazilians are lucky if they have one meal a day. We know that the pandemic did not invent vulnerabilities and inequalities, but it has exposed and in many cases compounded them. We're not only living through a health, economic, and social crisis, we are also living through an existential crisis. The youth in my country see no hope in the future. Their grandparents are their source of support. Once they die, the whole family plunges into misery. We do not become less of a person as we age. Our rights don't diminish with the accumulation of years. Every life has equal value. The most pernicious virus is not COVID-19, it is ageism. Unlike the coronavirus, ageism is a global pandemic. In common with other isms, ageism derives from four highly interconnected sources, the four big I's. It begins with ideology, a thinking that one group is more worthy, than another. It is programmed by another I, institutional, creating systems that operationalize the thinking that one group is more worthy than another. It contaminates and permeates through interpersonal, so that our statements and actions regularly reinforce that one group is more worthy than another. And finally, it leads to internalization, an acceptance by the marginalized themselves that they are indeed less worthy than others. But that is the ultimate goal: exclusion, oppression. Ageism can impact every age group, but there is no equivalence between the impacts of any ageism experienced by younger persons and the ageism experienced by older persons. We have plenty of evidence that ageism directed at older persons disables and kills. All older lives are vulnerable to it. All older lives, those that are already old and those that will be in the future. For many, ageism builds on a legacy of other forms of discrimination, arriving on top of a life history marked by social exclusions, precarious employment, low self-esteem, and insecurity. The structural disadvantages that have framed younger selves inevitably produce an amplified effect in later life, an accumulation of inequalities. It would be a mistake, and arguably an ageist act in itself, to dilute any focus on ageism as it relates to older persons. Age discrimination shares some features with other discriminations, but it is specific in its harm. The response to it must be specific in its actions. This slogan, "All lives matter," is all too often weaponized to distract from lives that have a clear history of mattering less. The opposite of being racist is not being non-racist. It is to be anti-racist. The opposite of ageist is not non-ageist, is to be anti-ageist. Same as for sexism. Claiming to be non-racist, non-ageist, non-sexist is simply a denial. Being anti-racist and anti-ageist is a commitment to do something, to be an activist. It applies to all discriminations: sex, race, age, sexual orientation. To be anti-racist, anti-sexist, anti-ageist requires regular self-examination and purposeful activity on our part. At whatever age we are to be, the ageist is to be self-educated, willing to call our discrimination whenever we see it, and uncompromising in our demand for full dignity and citizenship for everyone at every stage of our lives. The enormous heterogeneity of a much more expansive and complex older age is now more recognized. It reveals the absurdity of the notion of sameness, the premise upon which ageism is built. You are not same. The cultural and economic changes brought about with the triumph of longer lives is capable of generating almost limitless potential for overall human development. An African saying observes, when an older person dies, a library burns. We have to stop lighting the fire. Thank you.
Thank you so much, Dr. Kalashi. Those were very inspiring words. And we really want to support the idea of a working group to begin drafting the convention. That involves, of course, representatives from the groups, NGO groups. Now, I'd like to introduce our next speaker, who is a famous Canadian. Ambassador Bob Rae is the permanent representative of Canada to the United Nations in New York. Ambassador Rae was a former premier of Canada's largest province, Ontario. He's a former parliamentarian in Canada's federal government. He has extensive credentials in regard to human rights, first as a fellow at the Raoul Wallenberg Center for Human Rights, and as Canada's Special Envoy to Myanmar and Canada's Special Envoy on Humanitarian and Refugee Issues. Like all our other speakers, his awards and honors are far too long to list in the time we have. Ambassador Rae, you have the floor.
Thank you very much, Margaret. It's great to be with you all. I never met Dr. Kalash before, about half an hour ago. And you know, when you're a speaker, you kind of figure, like, who do you want to follow? And I want to follow Dr. Kalash in many ways. I want to follow his ideas. I want to follow his example. And I want to follow his leadership, but I don't necessarily want to follow him as a speaker. It's a little difficult, but I will do my best in my way. I want to say from the outset that I think one of the opportunities that being at the United Nations gives me is a chance to work with a great many Canadians on issues that really concern them, and then not only to work with Canadians, but to work with people around the world. And I do think that what COVID has done is to magnify realities and situations which many people knew and many people were aware of, but not everybody was. And in particular, I think that what COVID has done in Canada has been to magnify and to make people aware of the unacceptable level of discrimination against people as they get older. We're not alone in this. We're not the only country of which this is true. But I say to my fellow Canadians, it's more true of us than almost anywhere else in the world. As has already been stated, Margaret made it very clear. We have more Canadians, more seniors Canadians, as a percentage of those who passed away. More seniors in Canada have passed away, people living in institutions, people living in long-term care facilities than in any other advanced economy. And this is not a prize that Canada should ever want to win. No country should want to win this prize, but we do have to embrace the moment and understand that this is actually what has happened to us as Canadians. And when you're in an international forum like the one we're in today, we have to recognize that this is our particular challenge as Canadians. But we also have to recognize that the challenge facing seniors in Canada is widely reflected around the world. Dr. Kalash has spoken so eloquently and with such passion about what is happening in his own country, in Brazil. And we've all been following the events in Brazil with enormous sense of sadness and anger and frustration, which is what he has expressed. But I think what Dr. Kalash has also expressed is a sense of how do we go forward. Si je peux m'exprimer un peu dans la deuxième langue officielle du Canada, c'est-à-dire le français, et j'espère que vous pourrez tous me suivre, en disant que nous devons reconnaître comme Canadiens que le nombre des aînés qui sont morts à cause du COVID au Canada est plus grand que d'ailleurs, que le nombre de personnes dans les hôpitaux, dans les maisons de soins, etc., sont plus grandes que dans d'autres pays, et que nous avons un défi alors particulier c'est naturel que le Canada devrait enfin devenir une force pour le changement et pour la reconnaissance de la situation particulière des gens âgés dans le monde, dans notre monde aujourd'hui, que peut-être dans le passé. So we have to recognize the challenges that people are facing. And we also have to recognize what this means. We have to understand that this is not a situation created by the pandemic, but it is a situation that has been exacerbated and magnified by the pandemic. So practical things we need to talk about. The request by health experts, for example, for individuals to practice physical distancing, including restrictions on visits from friends and family in many care facilities, has placed an additional burden on older persons during the pandemic. And we know from everything that's been said, and Dr. Kalash said it most eloquently, ageism further isolates and marginalizes older persons within their communities. Perhaps I can even be permitted to say, and Senator Bovee will know what I'm talking about when I say this, is that at the advanced age of 72, the Prime Minister asked me if I would take on this job at the UN, and there were many people who commented to say, well, Bob Rae can't do that, he's too old. Well, here I am, I feel fine. My mind is still working. My body gets through the day just fine. And I think we need to really reassess how we look at people and how we recognize their skills and talents, and also to understand that ageism is another ism that just can't be allowed to happen without being seriously challenged. We need to also understand that older workers, caregivers, and volunteers who can't easily isolate themselves are also more exposed. And measures are also needed to help those who've lost their job or working reduced hours because of the pandemic. And as we know, many seniors have been told that it's time for you to give up your job. It's time for you to go. It's time for you to leave the workforce. The reality is that people can't do that in today's world without losing income that they desperately need. Alors, le Canada s'engage et doit renouveler ses engagements à protéger les droits de toutes les personnes. Et le Canada reste profondément préoccupé par la situation des aînés qui sont touchés de manière disproportionnée par le COVID-19. Nous devons également reconnaître l'importante contribution des personnes âgées à la réponse à la COVID-19, notamment en tant qu'agents de santé, soignants, bénévoles et leaders communautaires. Sur le plan national et international, la promotion et la protection des droits de la personne est et va rester une priorité du gouvernement du Canada. So we were very proud, as my friend Omar, the ambassador from Morocco, has stated. We're very proud to be among the first countries to have signed in May of 2020 the statement of support to the UN Secretary General's policy brief on the impact of COVID-19 on older persons, where these issues were discussed and many others were also discussed. But I want to stress that I think it's important for us to go from the report and the policy brief for us to go to how is the policy brief going to be implemented. And I noticed on the chat there was a question from someone saying, is it possible for us to have a working group to really move this forward? The answer is absolutely. Yes, it is. And Canada will be glad to participate in such a group. We're committed to implementing the 2030 agenda while cutting across the goals on poverty eradication, good health, gender equality, economic growth and decent work, reduced inequalities, sustainable cities. We're also proud to have a feminist foreign policy, which allows us in particular to look at the full diversity of older persons, such as happened in the SG's policy brief. Women, for example, are overrepresented among older persons and among the paid and unpaid care workers who support them. And in Canada and around the world, many Indigenous elders continue to play important roles in protecting and passing on their cultural identities and languages to their families and communities. And we know that language and culture can serve as protective factors against health crises and social isolation. So in short, Canada looks forward very much to continuing our work with those who are pursuing the open-ended agenda. But even the name makes me feel that, yeah, it's an open-ended agenda, but it's an agenda that needs to be supported and needs to have the firm sense that we do. Just because it's open-ended doesn't mean we don't have goals and we don't have a set of objectives that we want to achieve. And so let me talk about a couple of things. One is the issue of whether or not it's a convention that's necessary. And my own view is to say, look, we've passed conventions over many, many years, since 1945, indeed since 1919 at the League of Nations, to try to mobilize global opinion and global action, establish global standards, and then figure out better how things can be implemented and done. I think we have to appreciate in Canada, and it's like an old joke, we realize that this is going to be a federal and a provincial issue. We realize that the provinces have a primary responsibility with respect to social services and healthcare. And in many cases, will have to be involved directly in how such a convention could or would be drafted. But I don't say that in order to simply dismiss the idea or put it aside or say that we don't think it's something we should be engaged in exploring and discussing with a number of other countries. I say it in order to, in a sense, try to give encouragement to everyone here to say, let's get working on this idea. Let's figure out the steps we would need to take to get it on to different agendas, both provincial and federal. And let's also deal with our international partners to see how things could be moved forward in a practical way at the international level. And finally, I just want to say on a personal note that we were talking before everybody came on the program, as it were. People were asking, well, were you influenced by older people? And the answer to that is yes. I was influenced very much by my grandparents, my grandmothers, my two grandmothers, who both lived to be nearly one of 100, the other 107. My own mother, who lived to be 100. My father, of course, many uncles and aunts who've continued to be sources of inspiration, mentors who've been important to me throughout my life and remain very important to me. And now I find that some of my mentors are younger and some of my mentors are older. My work in other cultures, indigenous cultures that I mentioned, but also in other cultures around the world, where aging is treated not as an illness, but as a natural process, where people who get older are not excluded or warehoused or sent away, but actually embraced to remain in the home and in the house as long as possible, as long as they want to and as long as they can. And where the advice of people who've been through things and have had a great experience is something that I think can make an enormous difference in getting us to embrace all of our qualities and all of our humanity. So for me, this time at the United Nations will give me an opportunity to continue to work on this, to express some thoughts about it, to see how we can effectively work together, and to put my skills, such as they are, to work in order for us to make some progress. And thank you very much. I appreciate the opportunity. Merci beaucoup. Miigwech.
Thank you so much, Ambassador Ray, and we know your skills and we're very happy to have them on our side. I'm so happy that you ignored those ageist comments, and we're very lucky to have you here at the United Nations as our ambassador. And we are absolutely thrilled, and ILC Canada would be very happy to support a working group looking at ways we could move towards a convention, and happy to support that work. So thank you so, so much. Now, I'd like to introduce another great Canadian, the Honorable Patricia Bovey from the Senate of Canada. Senator Bovey was appointed to the Senate in 2016 and has an incredible connection to the arts as a historian, a professor, and a gallery director. She has spoken in the Senate on issues dealing with older people, health, and the arts and culture. And she was the first Canadian parliamentarian to support the United Nations Convention on the Rights of Older Persons in her speech on November 19th, 2020 in the Canadian Senate. We thank her for her support. And I have handing the floor to you, Senator Bovey.
Well, Margaret, I want to thank you and wish everybody a good afternoon. And it's such an honor to be here, to be part of this special event and to follow such distinguished people. I feel quite daunted. I do speak today from Winnipeg, Manitoba, the traditional territory of the Anishinaabe Cree, Oji Cree, Dakota, Dene peoples, and the homeland of the Métis Nation. It really is an honor to be part of this discussion on the impact of COVID-19 on the human rights of older persons. I support the proposed UN Convention on the Rights of Older Persons. It's particularly timely now, considering the pandemic events of the past year, which have exposed many nations' societal cracks. Ambassador Ray, we've worked together on things before, and I'd be very happy to work with you on how we best go forward in dealing with these serious global and Canadian concerns. I thank you for your leadership. Canada's Chief Public Health Officer stated recently that the largest lesson learned during the first year of the pandemic is that, and I quote, "We failed our most vulnerable." The tragedy and massive lesson learned for everyone in Canada is that we were at every level not able to protect our seniors, particularly those in long-term care homes. Even worse, she said, is that in the second wave, we warned of the resurgence, yet there was a repeat of the huge impact on that population, end quote. These are blunt, but such true words. Her Majesty Queen Elizabeth II has said, quote, "Hope may be found in the care we give the vulnerable in a time of need," end quote. We failed our seniors. We did not protect them in their time of need, and we were warned this could happen. Myriad reports, studies, and papers presented over many years laid out the urgent need for us to make changes in our healthcare approach, which would have prevented the most dire effects of this pandemic. COVID-19 does not discriminate between those it infects, but it does affect the vulnerable in our populations to a much greater degree. On January 25th, 2020, the first confirmed presumptive case of COVID-19 occurred in Canada. On February the 3rd, 2020, the first recorded case of COVID-19 was linked to community transmission. On March the 7th, 2020, the first COVID-19 outbreak occurred in a long-term care home in Canada. By mid-April, Canada's military had been tasked to assist in what had quickly turned into a national nightmare in Canada's long-term care homes. The report they issued is scathing and presents a picture of neglect. It is not easy reading. The cost of the military intervention then was $53 million. A continuum of care would have cost so much less in dollars, deaths, and mental health. Indeed, a May 25th, 2020 OECD report indicated 81% of known COVID-19 deaths in Canada occurred in long-term care homes. As of August 2020, the total number of deaths linked to COVID-19 across Canada was 9,000, 7,200 linked to long-term care. This morning, the Canadian Institute for Health Information reported 69% of Canadian COVID deaths were in care homes, the international average being 41%. Outbreaks in 2,500 Canadian care homes resulted in 14,000 deaths by February 2021. Care homes had less medical care, fewer doctor's visits, and fewer hospital transfers than in earlier years. The second wave increased infection in homes by 62%. I've heard so many stories of the suffering residents of these homes have gone through during this pandemic. In one instance, an entire group of friends who lived and spent time together in their home were gone within days of each other. My heart reaches out to those who lost a parent, grandparent, family member, or friend without a last visit or a hug from their loved ones. Families are justified angry at the way we have treated our seniors. The isolation has been devastating, impacting those with and without COVID and all generations. Those without family visits fared worse. Isolation bred fear and despair. People gave up and died. Many could not comprehend the COVID circumstance. Families filled with fear and anguish suffered a real sense of loss. How important those hugs are. I feel for those care workers who did their best to provide that care and comfort in the absence of families. Stories of frontline workers spending their own money on personal protective equipment, holding residents' hands to provide some humanity in their time of death, remind us of the extreme mental and physical hardships that they went through. I thank them for their dedication. We must now embrace the painful lessons and truths learned regarding the human rights of elder persons during this pandemic. We must fix the broken long-term care system. Canada must develop national standards on long-term care. We must increase trained staff. I hope we're moving in that direction. Canada's Chief Public Health Officer advises, and I quote, investment in community health and social services that support older adults to continue living independently at home could also prevent the emotional, social, physical, and financial hardships associated with leaving home to live in long-term care residences, end quote. Dr. Samir Sinha noted in today's report, quote, it really tells us that there were things we could have done to avoid a lot of deaths. Countries that were better prepared, that had better funded systems, performed far better than Canada, end quote. A sad comment. Canadian architect Rudy Friesen opined, quote, we need a multi-pronged approach to caring for older adults. We need a system that is more humane, trustworthy, accountable, equitable, economical, integrated, and resilient. I say, now is that time. The household model of care home, much more like a family situation, is proving successful with more consistent and better trained staff, single larger rooms giving greater space, and of course, smaller groups of people, allowing better human connections, better ventilation, and better infection control. In the wider context, this is about society providing the respect and dignity our elder persons deserve. The pandemic highlighted the reality that elder persons do suffer from isolation, food and economic insecurity, lack of services, lack of participation in society, and that the mental health issues those worries produce are significant. We must build better communities to address these concerns and encourage intergenerational approaches, honoring the need to connect the marginalized and the vulnerable. My own mother, in her advanced dementia in her care home, benefited so much from family visits and those of my children's friends, and from the regular visits of a preschool and special visits with pets. We must also address the increasing incidence of elder abuse which occurred during this pandemic, including physical abuse, emotional abuse, neglect, abandonment, and financial abuse. This must stop. Since the outbreak of COVID-19, people manning the phones at elder abuse lines have experienced a dramatic increase in calls, a sad testament to the need for more protection for our aged population. The hiring of elder persons advocates must expand. Now is the time for Canada to support the UN's work for an international convention on the rights of older persons, certainly given the pandemic, but not just limited to incidences of pandemics. Experts have defined what a UN convention on older persons would do. It would confront ageism, assist in policy making and accountability. It would educate and empower the rights holders. It would honor the selfless lives of elder persons, their hard work, their wisdom and compassion. We must support this international initiative. We must protect human rights based on compassion and empathy. Quality of life, not just longevity, is important. We must encourage the continuation of prior activities, exercise, engagement with music and color and conversation. Human rights do not have a best before date. Thank you.
Thank you so much, Senator Bovey. We will be definitely following up with you in terms of your offer to support our work going forward. You can be sure you'll be hearing from us, and we're thrilled by your leadership. And thank you so much. And thank you for being the first parliamentarian to support the convention and to speak so eloquently to it today. We have another very special Canadian coming up. As you heard from Senator Bovey, the frontline workers during the pandemic have really been absolutely heroic. And I have an example in my own experience, because my brother-in-law died very early in the pandemic, and it was a healthcare worker that went in and held his hand as he died. So I'd like to introduce with that the next speaker, who is Dr. Ann Collins. She's the president of the Canadian Medical Association. For 3 decades, she ran a family practice in New Brunswick. In addition to office and hospital care, she provided nursing home care for 20 years. She's also was a professor at Dalhousie University. She served as the president of the New Brunswick Medical Society prior to her service as president of the Canadian Medical Association. Dr. Collins, you have the floor.
Thank you, Margaret. Good afternoon, everyone. Thank you for the invitation to join you today, and to ILC Canada for their leadership in putting together this event. I would like to begin by acknowledging that the land on which I am speaking to you from in New Brunswick, Canada, is the unceded territory of the Indigenous Maliseet peoples. We pay our respects to the traditional caretakers of the land, and we affirm our commitment to reconciliation, our shared stewardship of the land, and our relationship with one another. As president of the CMA, I am proud to be speaking on behalf of Canada's physicians and medical students. Together, we strongly support the call for a new international convention on the human rights of older persons. Around the world, we have seen what happens when these rights are not protected. The pandemic has exposed and exacerbated a host of challenges for older populations, from ageism to inadequate health care, social isolation, and financial insecurity. In Canada, in particular, as Senator Bovey so powerfully captured, we have witnessed a tragedy in long-term care. The CMA has strongly supported our federal government's commitment to develop new national standards for long-term care. The CMA is here on the international stage today to acknowledge the failures of our support systems and to learn from other countries who are leading the way in caring for older citizens. This is an incredibly important conversation for Canada to be a part of. Over the next 30 years, the number of Canadians 85 years and older is expected to more than triple. Building on what Senator Bovey described, it is crucial that safe, compassionate, and quality long-term care options are available for those who need them. And standards must be put in place and be strictly enforced. Beyond that, I believe we must fundamentally change the way we look at caring for older Canadians. We did a survey recently in partnership with the National Institute on Aging in Toronto. It showed that 96% of Canadians aged 65 and older would do everything possible to avoid living in a long-term care home. For too many, long-term care has become the only resort, despite the fact that most Canadians would prefer to age at home. However, when we look at the overwhelming demand on our home care system, that option is often not feasible. Throughout the pandemic, we know anecdotally that many older Canadians have been suffering in their own homes. increasingly isolated and cut off from crucial home care support, which was deemed a non-essential service during the pandemic. This has affected not only their physical well-being, but has had a huge impact on their mental health. But as we have seen with long-term care, the problems long predate the pandemic. That includes huge staffing shortages. In the first quarter of 2020, before the full impacts of COVID-19 were felt, there was a 46% job vacancy rate among home support workers in Canada. This is nearly double what we see on average across other occupations. Further, 91% of businesses employing home support workers said they were constantly recruiting, compared to 50% across other occupations. Again, sadly, this is not a big surprise. We know workers in this sector, who I call angels, have long been vastly undercompensated, and in the case of the pandemic, often not supplied with the necessary personal protective equipment to do their job properly and safely. What we have seen as a result is an over-reliance on family caregivers to fill gaps. Data show that as much as 75% of direct and community care in Canada is provided by family caregivers. They are largely untrained and provide nearly 20 hours of unpaid care per week. At the CMA, we are calling on our federal government to provide more financial support for family caregiver partners as a first step to recognizing their invaluable role. And we could be doing so much more to support them, whether it is through education and training, peer support, or respite care. Even so, the entire solution cannot rest on their shoulders. By the year 2050, there will be 120% more older Canadians in need of home care. Over this same period, there will be approximately 30% fewer family members available to serve as potential caregivers. So it is crucial that Canada develop and put in place a much more robust home care system for older citizens who want to age in their homes. Such a system should include better supports for formal and family caregiver partners. It should also promote social engagement and mental health supports, nutrition, physical activity and therapy, and injury prevention. Additionally, it will be important to push for more creative use of virtual care and remote monitoring as a complement to hands-on care to make home support more efficient, effective, and widespread. As you can see, Canada is still working to develop a care system that equitably serves older Canadians. In being here today, on behalf of the CMA, we want to collaborate with the international community on how we may all respect the rights of older persons. That is why CMA is fully behind the creation of a new convention on the human rights of older persons, and we call on our government to support it as well. We want to thank ILC once again for their efforts to support this important conversation today. It should not have taken a pandemic and far too many lives lost to make elder care a priority. It is beyond time that we prioritize this essential component of our system so that we can fully protect the health, safety, and dignity of older persons. Thank you.
Thank you, Dr. Collins. That was very poignant as well. And we do indeed need to learn from people around the world about the response to the pandemic to make things better in our own country. And we are very grateful for the consistent support of the Canadian Medical Association for the United Nations Convention on the Rights of Older Persons. We thank you for your support with our call to the government. So thank you very much. Our last speaker is Dr. Claudia Mahler, United Nations independent expert on the enjoyment of all human rights by older persons. Dr. Mahler was appointed as independent expert in May 2020. Her timing's impeccable. She's a senior researcher in the field of economics, social, and cultural rights at the German Institute of Human Rights since 2010. She has conducted research on human rights and was a lecturer in the field of human rights law. She has been a tireless leader through the pandemic on the rights of older persons, and the floor is now hers. Thank you, Dr. Mahler.
Thank you, Margaret. I'm just thinking because of the time, how much time I should spend on my speech, or if we also should start on Q&As. But I will give you some thoughts of myself, and then maybe we can
go to questions. Yeah, we have till 1:45. We have another 15 minutes, so
okay.
We have a few minutes for, but yes, perhaps if you don't mind.
No, don't worry. So thank you so much for inviting me, dear Excellency, Senator, ladies and gentlemen, colleagues and friends. I'm really happy to be here with you today, and it's a great pleasure and honor for me to address you at this side event on the impact of COVID-19 on the human rights of older persons at the 11th session of the Open-Ended Working Group for the first time in my capacity as independent expert on the enjoyment of all human rights of older persons. So let me thank the organizers for this timely event, and I'm really looking forward to get more engaged, hopefully in a more personal setting in the next time. It is essential and timely to bring together key stakeholders from the South and the North, to have a meaningful exchange and to lay the basis for further discussions and collaboration, to learn from each other, to see how regional approaches might give us guidance for the global level. We learned during the previous presentations in this side event that states have not been prepared to protect the human rights of older persons in the South and in the North. Older persons' human rights have been violated in all states in different settings, but we can resume that older persons have been left alone. I'm pleased to address you all of you during these difficult times, almost 1 year after I assumed my position as independent expert, and after the current crisis showed us that we are facing a global pandemic. It is a paradox that despite being in the spotlight during the pandemic, older persons remain chronically invisible. Indeed, the pandemic exposed the flagrant lack of data on older persons and their lived realities. This issue was examined in depth in a report that I presented to the Human Rights Council last September. There is an acute need for additional and more granular data to develop evidence-based policies that are inclusive of older persons in their diversity. Without it, meaningful policymaking and normative action are practically impossible. We also heard a couple of statements today that it seems very obvious that states are looking forward to get more data for the national action plans. I was encouraged to see the political support in the Secretary General's policy brief in May, where he clearly pointed out that the rights of older persons are at stake and that it is urgent to bridge the gaps in strengthening the human rights frameworks on the national and international level. And I'm really grateful that this statement was supported by more than 140 states, NHRIs, and NGOs. We heard in the opening session the words of Ilse Brands-Keris, Assistant Secretary General for Human Rights. She called the open-ended working group to follow the mandate, quote, request the working group to present to the General Assembly at the earliest possible date a proposal containing inter alia the main elements that should be included in an international legal instrument to promote and protect the rights of and dignity of older persons, which are not currently addressed sufficiently by existing mechanisms and therefore require further international protection. The pandemic had much impact on all of us. The impact on older persons has been particularly wide-ranging and worrying, as they have been denied health services, experiences, physical and social isolation, and as we heard here very often in the previous speaker's statement, died alone. This happened in all regions of the world. They have been left alone in care homes, exposed to violence, neglect, and abuse, and this happened in the richest countries of the world. The pandemic exacerbated experience of lack of autonomy and participation in decision-making, including due to the digital divide. Older women especially have had risks of violence, abuse, and neglect in the context of lockdown measures in all parts of the world. And it was seen that there have been many discussions on violence against women and domestic violence, but older women have been excluded from these discussions. Older persons in precarious conditions, refugee camps, informal settlements, prisons, also faced higher risk due to overcrowded conditions, limited access to health services, water and sanitation facilities. Allow me to remind you on some of the statements government delivered during the last years. As you know, the open-ended working group started a decade ago. We heard that a comprehensive binding legal instrument is not needed because the current system protects persons of all ages. But till today, it strikes me that we did not see any sufficient change during the last decade, which made older persons more visible in the current human rights system. The speeches told us that it is just a lack of good implementation. But where is the increase of better implementation? We only witness through the current crisis that older persons have been left behind. They did not receive the necessary health service or care, support, or even did not get the assistance they needed for their daily lives. Overall, the last year has magnified the human rights challenges faced by older persons who have often been portrayed as vulnerable and needing protection. This can feed into existing stereotypes, and it is therefore important to always stress the diversity and multiple roles older persons play in society. The pandemic did reveal entrenched ageist attitudes, including age-based discrimination and stigmatization of older persons. Derogatory remarks and hate speech have emerged in public discourse and on social media as expression of intergenerational resentments, for example, labeling older persons as burdens. There is an urgent need to combat stigma and ageism and age discrimination, which is why I'm preparing a report on this topic to be released next year. In this respect, the lack of a comprehensive and integrated international legal binding instrument to promote and protect the rights and dignity of older persons has significant practical implications. The existing international legal framework is scattered, uneven, and incomplete when it comes to the rights of older persons. For instance, it does not sufficiently cover crucial areas such as legal capacity, quality of care, long-term care and palliative care, assistance to victims of violence and abuse, available remedies, independence and autonomy, and the right to an adequate standard of living, in particular with regarding to housing. We will learn more on this missing protection in the next update of the OEWG11 analytical paper, which will hopefully be discussed further in the next session. I hope that this meaningful conversation leads to more collaboration to achieve our common goal, an inclusive, age-friendly society. Thank you for your attention.
Thank you so much, Dr. Maller. We really appreciate your work over the last year. You came in at a crazy time and have done wonderful, wonderful work. I'm now going to hand it over to my co-chair, Dr. Kiran Rabiru, for the Q&A and for the closing comments. So Dr. Rabiru, without any delay, over to you.
Okay, thank you very much to all the panelists and to Margaret for conducting the session so far. We are a little bit short of time, so well, I think what we'll do is we'll take a couple of questions and then wrap up. I think we need to finish on time. And so we'll start with the first question and we'll get a couple of people up live. The first one is from Mr. Matt Bover, who is the Director of Government Affairs for Home Instead. Matt?
Thank you, Doctor. Can you comment, if you would, on how a convention on the rights of the older person would be strengthened by a pandemic-specific ethical framework to deal with uncertainty and an absence of evidence to drive policy, as was experienced by COVID?
Can I, Matt, I think we'll direct your question to Ms. Maller. Claudia, would you mind taking that, please?
Thank you, Kieran, and thank you, Matt Bower, for the question. From my perspective, I would say that what already was said by the previous speakers, that the convention would have raised awareness in the starting point, and the governments would have been prepared, because there would have been a priority on older persons. So it wouldn't have been such a surprise that older persons need more protection for the human rights, that it would be ensured that the healthcare system would work properly, and that not only hospitals would get the protection for the personnel they needed, also the care homes would get that. And I'm quite sure that, as have been spelled out in many other discussions, that older persons have not been in a priority to the existing action plans. And therefore, this convention might be a real changer for the game. I hope I could answer your question in this, but I don't want to elaborate more on this. Thank you.
Okay. Thank you very much, Claudia. I appreciate that very much. And we'll take one more live question, and this one will be from Jane Barat. And Jane is the Secretary General of the International Federation on Aging. Jane, you have the floor.
Thanks very much, Kieran, and thanks for the opportunity to present a question which is specifically directed to their Excellencies, Mr. Halil and Mr. Ray. Each of you have had illustrious careers in diplomacy and politics, where your knowledge and influence has changed the lives of citizens of all ages. You have stood up for citizens who are most marginalised, oppressed and discriminated against, including Indigenous people, older people, migrants and refugees. Your efforts have been noted in your country of origin, but equally in many countries around the world. The world has and will continue to face many humanitarian situations, including the current pandemic, which will challenge the very fibre of our souls to create solutions. For each of you, what is your one key action that civil society needs to take to encourage member states to take the action to start drafting a convention? Just one key solution for civil society to act on. Thank you very much.
Jane,
I think Omar has left the premises, so yeah. I'll take it. I think the key thing, Jane, and thank you so much for your question. I think the key thing is to show in practical terms how any instrument, whether it's a convention or whatever it might be, actually could have an impact on what is going on in your country. I think that's the key thing. I think that it's sometimes seems like an abstract thing, a UN convention. People say, well, what impact will it have? But I know, for example, that on something like the UN Declaration on the Rights of Indigenous Peoples, which frankly, member states and governments were very skeptical about for a long time. I think now we can see, certainly in my country, in Canada, and I think in other countries as well, I think it's had an impact. I think it's having an impact in terms of moving opinion and moving policy. So I think we always need to link the aspirational goal that is set out in a convention and say that this is what it means. This is what could happen. This is the difference that it could make. And I think that's going to be, the basis upon which we'll move a number of governments to move forward.
Thank you very much, Ambassador Ray. I know Dr. Kalash wants to make a 30-second comment on Jane's question. So Alex, 30 seconds, please. Thank you.
One of the things that I said, Jane, was that it's not only coronavirus. We live a pandemic of ages. And we have learned in the plague from Albert Camus through the main protagonist, Dr. Rie, there is only one way to fight a plague. In this case, the plague is not only the coronavirus, it's also ageism. And this is what is preventing further progress. Dr. Rie said clearly, there is only one way to fight the plague, through decency, enough with words and words and words that are repeated every year. Let us be decent and follow our mouths and really implement a working group that will draft, that will make progress, so that next year we are not going to congratulate ourselves saying the beautiful words again, and it will be 10 years since the beginning of the open-ended questions, and we are still to see what we have achieved. Decency comes first.
Thank you very much, Alex. And I am going to pick up on where you left off. And I want everyone who is listening at the moment to repeat after me. Enough is enough.
Enough is enough.
Let us all make a pledge today that what has happened to older people in the world in the past year will never be permitted to happen again, ever. My paternal grandmother did not have the privilege of a formal education. Nevertheless, she was a wise, intuitive, and incredibly caring human being and had a strong influence over my formative years. She would often say in her native language, which is Gujarati, "Bar jai koka, ne kar thai choka." To translate that, it means when people get old, they are regarded as empty boxes, needing to be put out at the curb to get your homes clean. This is precisely what I feel has happened to this segment of our population. Ever since aging has become a phenomenon in the last 100 years or so, COVID-19 pandemic has just exacerbated what's been happening before that. Many have been denied the basic conditions to promote quality of life, which includes safety, health, and happiness, and choices of where to live, purposeful and meaningful activity, and persons to love and care. For about 40 years, I've practiced as a physician exclusively with older people. And over this time, I've seen an alarmingly accelerated rate this past year of appalling, gut-wrenching, and heartbreaking situations of older people who were previously functioning well, but have succumbed to the ethically, morally, and sometimes legally corrupt universal violations of their human rights, including in Canada, where we spend over $265 billion on healthcare alone in 2019. The death, the suffering, the social isolation, loneliness, etc., which people have talked about today. So because we're short of time, I'm just going to skip to the end. The COVID-19 pandemic is very different than all the other pandemics we've had. This virus, by its very nature, is stealth-like, and its impact is selective, with most of its victims being older people. And younger people use defense mechanisms such as denial, minimization, and rationalizations evoked by the pandemic, closely linked to ageism that Alex has just spoken about. 50% of the world's population are ageist, according to the WHO report that was just published. And it used to be largely unconscious and implicit, but it is now conscious, overt, and out in the open. I keep saying to myself, this cannot be real. It cannot be happening. It's just a nightmare. But I'm wrong on 2 of the 3 counts. It is real, it is happening, and it is a living nightmare. This must stop now and forever, regardless of who you are, gender, color, nationality, sexual orientation, your functioning ability, country of origin, or any other difference we possess. We have 2 things in common. 1 is we are human beings, and 2, we're all aging. So frequently, one does not realize they're getting old until they get there. And beware, it's happening to you as well as to everybody else. And that's when you lose your human rights. That was the point I'm getting at. You don't know it until you lose it. Only a United Nations Convention on the Rights of Older Persons will provide a legally binding instrument and permit every policy, every decision, every action, the scrutiny that is required for a universal human rights lens. Research has shown plentifully that conventions on for example, on the child and the Convention on the Rights of Disabled Persons are highly effective also cost efficient. This is a call to action for all people on the webinar today, the open-ended working group, and to every member state to support this implementation of a Convention on the Rights of Older People. Let us not make the words of my grandmother come true for yet another generation or the generation after that, who have sacrificed enough lives, and let us not waste those lives that they've sacrificed. On behalf of International Longevity Center of Canada, Margaret and I, our deepest thanks to all the speakers today, to all the participants, all the sponsors, and the many kind souls who have helped us with this event. Your time, your dedication, your passion are appreciated in seeking a world in which older persons live free from discrimination and are fully able to enjoy their rights. Thank you very much. Thank you for attending today.